The first US case has been detected. There's confirmation the coronavirus has reached Australia.
China is urging its citizens not to travel abroad as it struggles to contain the virus.
We will be standing up Christmas Island as a quarantine area.
Foreign nationals coming from China are now banned from entering the country.
Imagine a world where healthcare is accessible to everyone, regardless of their socioeconomic status or physical location. A world where we can quickly and efficiently screen for diseases like COVID-19 without breaking the bank. This is the world that Respir is working towards.
The COVID-19 pandemic exposed the weaknesses of many healthcare systems, particularly in developing countries like Nigeria. With unaffordable and inadequate testing methods, the number of undetected cases rose.
To find out about the severity of this issue, we surveyed 130 people from 20 countries and 6 different age brackets. 81.5% of our respondents revealed that poor communities in their country suffered greatly from COVID-19. And 50.7% of respondents disagreed with the fact that countries were able to provide sufficient test kits for these poor communities.
But with Respir, we can change that. Our AI model can screen for COVID-19 using cough sounds, making testing fast, accessible, and affordable. By leveraging the power of machine learning and deep learning techniques, Respir can process large amounts of data and provide accurate insights.
But what makes us better than the rest? Well, our competitive analysis revealed that most of our users preferred Respir's non-invasive nature to traditional testing methods such as PCR tests and antigen tests. Interestingly, 61.9% of patients revealed that they found their traditional testing experience rather uncomfortable.
The market opportunity for Respir is huge, and we have already been accepted positively by our target markets through the research that we did, showing that 83.1% of the people prefer our app over to PCR tests being done.
To ensure that Respir was constantly meeting users' needs and making a positive impact on its direct and indirect users, we carried out frequent interviews with our target market and conducted surveys asking about suggestions and improvements which could be made to our app.
Hello, my name is Dr. Olivia Amaka. I am currently reviewing the Respir app. It's very easy to use. I believe that this is a very welcome innovation that would help in diagnosis of respiratory illnesses in real time.
Our survey allowed us to collect user feedback, which entailed suggestions and recommendations towards the improvement of our app. Many of our users suggested that there should be some form of medical assistance embedded into the app, such as a way for patients to speak directly to doctors. Other users also highlighted how they wanted the app to be easy to use and attractive with a good user interface.
In response to this feedback, we embedded a link to a telemedicine platform into our application, allowing users access medical assistance in the presence of a positive COVID-19 result. Also, our user interface was initially static, so we made our websites more dynamic and embedded the fonts to make them more readable.
We also asked people how they would prefer to use Respir, to which 90.8% said that they would prefer a smartphone application. In response to this, we decided to make a smartphone and smartwatch version in addition to our already existing web application device.
Our primary goal is to make our app accessible to people from different socioeconomic backgrounds. Hence, we're developing a low-cost device with our AI model embedded into it for medical centers with limited access to internet connection.
In the future, we also plan to expand the reach of our products, seeking strategic partnerships with stakeholders, including healthcare providers and hospitals.
We implore you all, therefore, to join us in this fight against COVID-19. As our app's name suggests, we have to protect the one thing that is common to us all, our breath, and we believe that Respir can pave a way to a safer and healthier future for all.